both camera and microphone when you are invited to speak so that this is picked up on the recording. If you wish to speak, please use the raise your hand function or indicate in the meeting chat and I will alert the chair. I will now do a roll call and would ask that members confirm their attendance when their name is called so that this is clear in the recording and can also be recorded in the minutes. Chair.
Present.
Councillor Cook.
Present.
Richie Johnson.
Present.
And Hussein Patwa.
Present. Good morning.
Thank you, Chair.
Okay. Thank you very much. Item 1.1 is on declarations of interest and transparency statements. Does anyone have any statement or? Yeah, Hussein.
Thank you very much, Chair. Should I say good afternoon? I'm obviously a few hours behind where we are. Just out of an abundance of caution, given the references to mental health and multiple papers, I would like to intimate the following transparency statements. I am a member of the Diverse Experience Advisory Panel, which is a named partner in the Scottish Government's mental health and wellbeing strategy, the actions from which are accountable to IJBs. And I am also the lived experience member from that group to the Scottish Government's Mental Health and Wellbeing Leadership Board. Thank you, Chair.
Okay, thank you very much. There are no items of exempt business. The minute of the previous meeting of the 30th of April 2025 has been circulated. Is everyone content with that as an accurate record of the meeting? No problems there.
Agreed.
That's approved. The business planner at 3.2. Do we have questions on the business planner? Could I ask? There was mention of a 6-monthly update on the I think it's on the midterm financial statement and the strategic plan. I think that's mentioned in the directions tracker, but it's not in the business planner. Was there an intention to bring back that financial information at some point? It is mentioned in the papers. Alison.
So just in relation to the strategic plan, we bring the quarterly delivery plan reports to RAPC, which is our means of reporting against progress on the strategic plan. So that would be the strategic plan aspect of that that request.
Okay, that's fine. And Richie.
Yeah, thanks, Martin. I was going to make a comment on the.
We can't really hear you, Richie.
Right, can you hear me? Is that any better?
It's quite a low volume.
See if I can make this louder. Is that getting better?
That's better.
Yeah, I'll take the mic. I'll take the headphones off. If can you just check how's that for volume?
Yep, got you.
Okay, perfect. Yeah, I was going to make the comment on the annual report. It's just that bit about the forward planning. I guess into the rest of this year. There's really 5 or 6 items, and I guess and understand some things might emerge during the course of that time. And if you look back at previous times, I think there are more reports than just the ones that are kind of scheduled. So again, maybe it's just that forward scan about what we might expect to come through later in the year. And if you can't put a date against it, I understand that. Maybe just identify where there might be future reports coming. It just gives the impression that it's quite light otherwise.
Yeah, thanks for that. It is quite a dynamic landscape that we're operating in, and yeah, it would be quite useful to have a note of potential future items of business there. So I think that's been noted. Yeah, grand. So we're happy to note the business planner. That's all noted. Grand. Thank you very much. The directions tracker is at 4.1. Are there any questions on 4.1? 4.1 directions tracker. Hussein.
Thank you, Chair, and please just bear with me throughout the meeting because I'm switching between multiple documents. It's just on the Morse work and the comment around funding from the Aberdeenshire IGB. Given the position that Aberdeenshire IGB find themselves in at the moment, and some of the announcements that they made earlier in the year, I'm just wondering if there's any update as to the likelihood of that funding. Well, I'll rephrase that as to what the likelihood of whatever happening to that funding is, and the potential implications on the project.
Okay, thank you. Alison?
Thank you. Yes, the funding was for the Morse Transformation Programme Manager, who was in post up until the end of January. So that funding has been received. The piece of work, as far as it was agreed, has been done. And we've no further funding to take any more of that forward. The programme manager, before she finished up, managed to transfer a lot of the outstanding actions into business as usual, and our colleagues in eHealth are continuing to do the bits and pieces of that project to see it through to conclusion without the need for specific or additional funding.
Thank you very much. Appreciate that.
Thanks for that. And then Richie?
Yeah, thanks. One question and a couple of comments. Just firstly, I can welcome the report. Some really good progress set out. So it's really good. And an ask around, I guess, when the contracts or grants fall for renewal, that again, we've got the committee, whatever committee it is, has got decent time, lead-in time to it. So it's not just at the tail end of the process. So that'd be helpful just to get that assurance. And the question was around the DPIAs at Appendix B. I wonder if anyone can say a little bit more about that, where there's either it's on hold or where there's no details, just that's not compromising service delivery, if you like, and that's in just where that is in terms of a process. Thanks.
Yeah. Okay. That'd be Alison. Could help.
I'll try and answer both of these things, but I'm looking at Neil around about the contract, the grants, some of the grants that we have, but absolutely, we're working towards lead-in timescales for the grant funding to ensure that we've got everything in hand to bring a report forward to IGB. I think there's a report on grant funding to come to IGB in December, prior to any decisions being made on extension to funding or funding for further years. I think each of the grant organisations got funding for 12 months. So that report will come in December, which gives us a sort of 3-month lead-in time to speak to the voluntary organisations and help them to understand what the funding may or may not be going forward. So hopefully that gives you assurance on that one. In terms of the DPIAs, what I can say there is the people who raise these DPIAs are in constant contact with the relevant information governance folks in both of the organisations. There is a lack of capacity around about in information governance in both organisations. I think it's fair to say, given the level of DPIAs that come forward to them. So we do try to minimise the impact of any delays in getting the DPIAs agreed. But there's some work that we can do in the interim. It doesn't necessarily mean everything stops, but it is a bit of a concern for us sometimes the length of time that it does take to get these approved.
That's helpful. Thanks.
Okay, thank you very much. And could I ask from on page 14, there's information there on first contact, which is mentioned as under review. I'm just wondering what's the future of first contact there. It's an important mental health and wellbeing resource that supports GPs. under review? Will there be ongoing resource through First Contact, or is that unknown currently?
So I'm afraid I don't know the answer to that. Or maybe Fiona does. She's put her hand up.
Yes.
I'll let you answer that, Fiona. Thanks.
Thanks, Alison. Teamwork. So we will continue with that service, Martin. We get additional money from the government to support it. So they did reduce that, and we're working through the teams how we manage that. But we will still get additional funding to make sure that we can deliver that. So there will still be a service being offered.
Okay, Grant and Hussein.
Supplemental chair to your last question on First Contact. Appreciate that was a dedicated project in itself. I'm just wondering, regardless of what the future of that service is, will we still be being very clear in the message of the no wrong door approach, so that those who require support in the community or anywhere within the system have that confidence that they can approach any part of the system and then being navigated accordingly to whatever it is they need to go, whether or not there's a dedicated First Contact service for mental health, which I wholly support.
Yeah, Fiona.
Yeah, I mean, absolutely, Hussein, we'd be looking to still make sure that we support people, and we've absolutely got our community link workers that will help us to enable that, Hussein, and they go over and beyond what we need them to do, but absolutely doing that signposting and making sure, and that's where we work very closely with our third sector partners as well. And Alison and myself and others have just come out of a meeting today, so SAMH have got approval from their board for 2026 to open the NUC in Aberdeen City, which is a great opportunity for us around about that early intervention and prevention and upstream, so that kind of lower level of mental health needs. So before they need the actual specialist service, but what can we do to support people earlier on? So I know that's another year away, but it's a fantastic opportunity, and delighted Aberdeen City are going to be benefiting from that with our partners in SAMH. Thanks.
Yeah,
thank you.
That's really positive to hear. Great. So are we content with the recommendations for item 4.1, the directions tracker? All agreed on 4.1? Yes, grand. Thank you very much. Next one is 5.1, the unaudited accounts.
Thank you. Yeah,
Yes.
thank you, Chair. The accounts presented today, just the draft accounts for presentation to Audit Scotland. I noticed Anne is on the call as well this afternoon. I would hope to meet with Anne, to go over the document prior to, obviously I'm leaving the organisation on the 1st of July, so very keen to catch up with Anne to go through that document in more detail. It's changed slightly from last year that we talk more about our performance, what we have done in the year at the front of the document. As you can progress through the document, you can see we have our governance statement, we have our remuneration report, and just to highlight in the remuneration report, outstanding is the pension costs for the named individuals within that report that we are just outstanding from our pension provider just now. Those will be put in due course when they're received. Moving on to the financial section, we've obviously had the report on our outturn for the year, and that's represented in the results where you can see financial performance, and obviously most notably within that report that we have no reserve balances left at the current time following the use of that money to balance our budget in 24-25. The document is presented in draft form and may change through the course of the audit work. So we just and obviously happy to take further feedback from members and participants at RAPC before the accounts are presented to the board in the autumn of this year. So Martin's chair is just a brief update of the document, and that it will progress as we go through audit. Thank you.
Okay, thank you very much, Amy, and many thanks for the very high quality work that you've done to produce these accounts. This is it's really hugely appreciated. I think that the I think the doc. I think we've got some feedback from some source. yeah, I just wanted to mention that it's really helpful that the document contains a lot of contextual information. I think that that's really helpful to understand the environment within which we're considering the annual accounts. I think that the data on multiple deprivation and on the risks, everything is very, very structured, very detailed. It's a really helpful strategic approach, which helps us to understand the population needs, the evolving population needs, as we try to meet the rising pressures and challenges in a time of very challenging, very tough economic decision making. So yeah, it is an extremely well presented, well developed text to help us to move on into through 25, 26, and then start planning for 26, 27 based on that tough financial situation. So many thanks for that, and can open to questions. We've got John first.
Yeah, no, Martin, I'd echo what you just said about the context and the readability and stuff. I think it's really good. Very minor point it's on page 21 of the additional circulation where we've got the stats on least deprived and most deprived areas. I think the figure for smoking in pregnancy in least deprived should be in most deprived and vice versa.
Oh,
Yes. Yes, thanks, John. I was able to correct that for the version that we now hold. So my apologies for getting those figures in around the wrong way.
Big tables like that with lots of stats,
Yeah.
it's easily done.
Thank you for your eagle eye there. And Richie?
Yeah, thanks. I get like yourself and John. I thought it was a really well written piece, accepting that it's still got some iterations to go, perhaps. But I didn't have any particular comment on it at this stage, other than to say, kind of welcome the work's been done on it thus far. I also did have one minor self-indulgent point, and it was on page 16. I have been confirmed as a member of the committee, so just a really minor point in the bigger scheme of things. But other than that, be happy to see it come back in due course. Thanks.
Okay, grand. Thank you. I think that's been noted. I think that we've got a really useful set of documents there, so that we can appreciate the complexity. And I understand that the next stage we come to the IGB with a report that will link the medium-term financial framework with the strategic plan. So this lined up approach will continue, I understand, for future fiscal planning, and if so, I think that will be particularly helpful for us, because so that we can understand the humanity in everything that we're doing. It's not just about numbers. So that's all really helpful. So thank you again, Amy, for your amazing support and commitment to the cause. Thank you very much. Are we content to agree those unaudited accounts, the report? We're okay with all of that? Yes. Yep, that's agreed. Lovely. We can move on to 5.2, which is our review of the committee. Are there any questions on this? It's quite a brief report, and it looks quite positive. I think I think it does note that the committee has taken action where required. It's fulfilled the duties. Its duties are set out in the terms of reference at 4.4. So that's encouraging for us. Richie.
Yeah, thanks again, Martin. I'm conscious that I joined the committee kind of halfway through the year, if you like, so I wasn't here for the full time. And the report, I think, is fine as far as it goes. And I guess that my observation, again, just for consideration, would be I think it's quite quantitative in terms of how it sets out fulfilling the duties around numbers of meetings and the numbers of types of agenda items. It doesn't say an awful lot more than that, which is, again, I think that's fine. But I did wonder if, just to add a bit of depth to it, if there's any kind of examples of outcomes that the committee had added as part of the consideration of some of the reports, just to bring it to life a little bit more, rather than just being, I guess, about the number of meetings and the type of agendas it had. So I didn't want the committee to undersell itself, if you like, in terms of what it's done. But again, I'm saying that in the knowledge that I was only here for part of the year, so I'm kind of conscious not to go beyond my brief experience. So that was the only thing other than that. Thanks.
Yeah, and that's a very relevant point. I think the committee would aspire to make a difference. Perhaps it is difficult to present that kind of qualitative change that we make, but there may be a way, as you mentioned, through mentioning cases, activities. John has got a suggestion, I think.
No, it was just a minor comment. It's the it was the bit on the roles and responsibilities, where the first one says ensure we've got an effective internal audit program, and we've got no reports against that. But actually, I don't think you need any reports against that, because when you look at the next column, next line down in the table, it says we've had lots and lots of reports from internal audit. So it just kind of struck me as a bit odd. But yeah, clearly we do get lots of internal audit reports. So I've got no worries that we don't have an effective internal audit function, even though we haven't had a report to say that we have. That was all.
Yeah, good point. And I mean, also there are columns against financial business and risk and governance, which don't really seem to have content. But that doesn't mean to say that things are not happening. Things are underway. I think that's just for completeness. So is it possible to get some feedback on those comments from Richie and John? Alison?
Thanks, Martin. Yeah, absolutely. I mean, the purpose of the report as it originally started was literally just to do that cross-check against the terms of reference, but absolutely that request around about some more qualitative information. I think that's really valid. Not sure how we'll manage it, but I'll give it some thought and see if I can. Might need to involve the committee on that one in terms of discussion, but absolutely happy to consider how we can build that into the next report.
Grand, thank you. Richie?
Yeah, Alison's just was the last sentence just covered what I was going to say. I guess it's just maybe it's for the next iteration of next year's report. Perhaps we can have that forethought rather than delay if the consideration of the report before us today. So yeah, that would be fine. Thank you.
Okay. Grand. So that's all the questions on 5.2. Are we happy to agree the recommendations? Yes, okay, recommendations agreed. On to 5.3, the internal audit update report from Jamie Dale.
Thank you, Chair. Thank you, committee. So this is our standard update report. We provide details of the progress of the internal audit plan and follow-up of recommendations. You'll see the final review for the year has been completed, and that will be presented next. And then the paper concludes with the updates on the 8 recommendations that were due as at the time of reporting. Thank you and welcome any questions.
Okay, thank you very much. Hussein?
Yeah, thank you very much. As always, a very enjoyable and informative report, so thank you very much for that. Just a bit of clarification around timelines, please. I note for a number of the actions for management, there is a comment to the effect that this has been briefly extended. Now, I have absolutely no doubt that internal audit will have dotted the I's and crossed the T's to make sure that they're assured that these things will be done and that these things are manageable. So I guess my slightly open-ended question was, what do we determine as the meaning of briefly extended? Is there a specific timescale in auditing parlance that means, or is there any other narrative that internal audit can give us in terms of how they've gained assurance on the completion of those actions in time?
Through yourself, Chair, thank you, Hussein. So for the recommendations, the majority of them were due in March 25, but from speaking with the Chief Officer of Finance, who is on the call and I'm sure will come in, they asked to extend them June 2025, so the end of this month. But for each of them, we don't just accept the updates, we actually meet with management, we look at the work in progress, and that update you get sent to the committee, that's also assurance from me that, yeah, do you know what, we're on track to implement them. Maybe not, maybe I'll have to come to you in July or the next this committee and extend it again based on management's comments, but based on what I've received, I am assured.
Thanks very much. That's really helpful. I wasn't sure whether the March to June was the extended time frame or the anticipated time frame. So that's really helpful, and I'm content with that. So thank you.
And Amy, did you want to come in on this item?
Yes, thanks, Chair. It was just to provide some assurance to members that we have gone through with Jamie where we are at with the audit recommendations. I just need to sit down with Jamie and go through and evidence that to him so we can formally close off items. So just to reinforce what Jamie's saying there. Thanks.
Grant, thank you. And Richie?
My question has just been answered, so I'll take my hand out. Thank you.
All right. Okay, fair enough. But that's great. Thank you very much, Jamie, for the report. It is really very much reassuring to see the very structured approach, which is very helpful for the IJB in its budget setting activities. I think that the scrutiny gives a lot of encouragement to help everyone involved in the IJB to be very focused, particularly around those challenges around primary care prescribing, for example, which is highlighted in the report, and the midterm financial framework and so forth. So it's a very, very helpful and positive exercise that we have there from internal audit. So thank you very much for that. So can we agree the recommendations on this report? We're all content with that on 5.3. Great. Staying with Jamie for item 5.4 is the commissioning paper. 5.4 commissioning.
Thank you, Chair. So the objective of this audit was to review plans and progress with commissioning across the Health and Social Care Partnership. Commissioning is a vital part of the Health and Social Care Partnership's operations. It is a key part of strategic planning and has been included in the plan given this importance. Overall, been able to take reasonable assurance, and that is positive given the significance of this area. We found that commissioning principles are being integrated at the strategic level within strategic documentation and in practice through the work of the commissioning lead engaging with services and service providers. However, there was limited evidence to demonstrate a planned and coordinated approach to embedding the principles across the Health and Social Care Partnership's portfolio, and this included the contracts and the commission services. It's detailed in the report, but areas where controls would benefit from improvement include alignment of commissioning with strategic intent, strategic planning, coordination, embedding of commissioning principles, and all these recommendations have been made to management, and I'm pleased to say that they've accepted them and I'll take them forward as part of a time-bound plan. I'm happy to take any questions, but I know we've also got the service on the call who can answer any questions from an operational perspective.
Okay, thank you very much, Jamie. There's just mention in the report on the management response at 4.5 that further details were going to be investigated on transparency and accountability to check on the delivery and so forth. That's all. Your content, internal audit is content with the management response. It just sort of suggested that was an ongoing conversation that, but you can confirm that you're happy with the dialogue with management and the timescale and so forth.
I am, Chair, and if I can maybe cover it here to maybe step in for Councillor Cook's point. I was going to cover it as part of my annual report, but the feedback I got as part of the consultation was that obviously you received the executive summary report. Behind that is a full internal audit report with a full management response to each of my recommendations. So based on feedback from yourself, Councillor Cook, the committee as a whole, I spoke with governance colleagues, and for the 25-26 plan, we'll present reports in full to committee. So you'll still be getting the instructions from me, but you'll actually see the detailed responses, and hopefully that allows kind of more information to the committee and then more scrutiny.
Yeah, that would be very welcome to help with focus. So we've got Hussein next.
Yeah, thanks very much, Chair. And before I ask my question, I do want to just reiterate that I take assurance from Jamie's report. And once again, thank you very much for the way that's laid out. And perhaps this is underpinned by John's previous point, but from my reading of the report, it appears to be that one of the key concerns that we have around recommendations is the level of staff resource that we have. That comes up several times in the report. So I'm just wondering, given where we are in terms of staffing, the finance pressures that we have, what we put into the medium-term financial framework around what we were going to do around staffing costs, I'm just wondering where that all sits in terms of the confidence that we have to be able to deliver the recommendations in line with everything else, whilst also keeping in place what we need to do to ensure that we dot the I's and cross the T's for commissioning.
Okay.
Sorry,
So
quite a lot in there.
who can help with that one? Who would like to chip in? Neil.
Yeah, I could speak to the on Friday the 13th. We did sign off all the recommendations and evidence them to audit, so they are actually all signed off now. Okay. So and that's mainly been through amendments to the Strategic Commissioning and Procurement Board, and ensuring that that SLT are fully informed of what's happening there, and also making it clear for all members of the board our responsibilities around the work plans, and making sure that we evidence any work that's been done there. I just also want to say that this has had a wider impact on us, that into my team then we have taken a couple of the recommendations and amended our own internal documents to support, especially around the strategic planning, and also the impact of the commissioning ethical commissioning principles already at the start of any commissioning process. So, but just to be clear, we have confirmed with the auditor that all of the recommendations are complete and signed off within the timescales.
Good. That's good to hear. Thank you very much. I mean that is very important, because since commissioning represents such a major proportion of IJB business, so embedding the principles is really important. So thank you very much. We've got Richie next.
Yeah, again, a bit of deja vu. My question's largely been covered already. Comments to Jamie initially, and then Neil just latterly there. And it was on page 64, they talk about further details on the management response, but I think that's been more than fully laid out just a wee minute ago. So if the recommendations are accepted and they've actually been being implemented and accepted and signed off, then that's great. So no, well done. Thanks.
Grand. Thanks for that, Richie. And then John.
Yeah, just briefly to apologise for colleagues for the fact that I made a suggestion which is going to give us longer papers, but I just thought it would be helpful to see the full Monty, as it were, so we can be. I mean, we are reassured by what Jamie says verbally, but it'd be good to see the full paper. So yeah, that was it.
Definitely. Yep, that's great. Thanks for the contributions on that item. Are we content with the recommendations on that? Yes, we are. Okay, that's agreed. 5.4 is agreed, so we can go on to 5.5. Again, remaining with Jamie, the annual report. Would you like to introduce it?
Thank you. So public sector internal audit standards require internal audit to provide an annual report on the adequacy and effectiveness of the board's framework of governance, risk management and control. Is one of the functions of this committee to review the activity activities of internal audit, including its annual work programme. The report covers the period from the 1st of April 2024 to the 31st of March 2025 and any work finalised during the assurance period. The report sets out the basis for my opinion, assurance assessment and other key reporting requirements, but I'm pleased to report that in my opinion, for the period in question, the board had an adequate and effective framework for governance, risk management and control, and I'm happy to take any questions.
Okay, thank you very much. I think that the report is very effectively formatted and presented. I think it's really good to have the quite high level approach through graphics and so forth, but also there's the detail. It goes into the detail. So I mean, I wanted to ask about the issue that's mentioned, the major risk issue of clearing the backlog of financial assessments. Just wondered if there's any further information that can be provided on that. I mean, it's a risk that rose from was it 996 backlog up to 1237. So I mean, it sounds like it's an ongoing issue, which is very useful to identify. But is that going to be an ongoing? Is that going to be an ongoing risk challenge? Claire, are you going to step in there?
Yes, I'll come in and answer that. So it was a particular risk because it's such a small team and the demand of the financial assessments was creeping up. So we did just before the audit have 2 extra people that came in to help, and unfortunately they then left. So 2 new people have joined the team and they are now all trained, so they are working through that backlogs, Chair, and they're doing very well. I don't know off the top of my head what the number that we're sitting with just now, but it would be nowhere near what it was before. So fingers crossed, the 2 new people have joined the team and they will remain, and I think there's processes in place to get through them more timely, but it was just the demand of the assessment. So but you know, things are looking a bit more positive. We just have to we're keeping a very close eye on it that they don't creep up again.
Yeah, that's great. I think it's very helpful that the issue's been identified and has been given a considerable focus, because the impacts on the individuals and the families they may vary, but I think in some cases they would be major. So
it's significant, and we're also meet regularly with the finance team, because sometimes the social workers have to get maybe some more information so that they can proceed with the financial assessment. So we are meeting on a monthly basis to look at that work and just make sure that we're kind of making that happen as quick as possible.
Grand, thank you very much. Richie.
Welcome Jamie's positive opinion, and always good to see. And two bits of, I guess, not even issues, reassurance, I guess. I'm not sensing any issues at all in these areas, but just, I guess, to be good to hear it. In terms of the resources at Jamie's disposal, that Jamie, you feel you've got enough capacity in order to do the jobs that you do. Your positive opinion suggests you do, but it'd be good just to be sure of that. And the second bit is just that engagement with the wider team, the health and care partnership team, around how, I'm seeing from the feedback and the way audits are treated and responded to, that seems to be pretty constructive. But again, just a comment on that, the nature of that kind of relationship being constructive would be good just to be certain of. So thanks.
Thanks, through yourself, Chair. Thanks, Richie. So in terms of resource, yes, adequate resource, and to confirm that to committee, we do that through the annual planning process. So behind that plan, there are kind of allocated days based on my resource, but also the availability of health and social care partnership staff. We can't obviously bombard them when they've got a lot of business as usual and our priorities, but no concerns from me on the resourcing. And then I think that leads itself into the engagement piece. Absolutely no concerns to flag with regards to engagement with reviews, follow-up, any ad hoc meetings, not to kind of put them on the spot, but the chief officer, the chief finance officer, they really make themselves available to me when required to kind of have discussions on internal audits, on any strategic pieces. So positive from me and no concerns to raise to the committee.
That's good. Okay. Thanks to all concerned. No, thank you.
Great. Okay. So there are no more questions. Can we agree the recommendations for that report? Could we have a 2-minute break because my computer is running out of power and I'm going to have to get my cable. So we could just have a 2-minute recess whilst I recharge. Sorry about that. Okay, good. On that. On that. Okay. So can we reconvene? Is everybody still here? Sorry about that. And many thanks, Jamie, for the reports. Thanks to you and your team for the excellent internal audit work that really helps us. And I think it's very often inspiring what you do. So thank you very much. And we've already agreed that item, so we can move on to 6.1, which is the locality planning annual reports. Any questions on this report, 6.1? Richie.
Not particularly any questions, Mark. It's just a huge amount of information and really valuable information, and seeing the kind of tangible benefits and outcomes and services that are being provided set out in that way was really good. And I guess if we did have a query, it's perhaps around about, I guess, how, and whether it's, I'm not sure if this is Fiona, without putting Fiona too much on the spot, but I guess it's how we as a partnership can best engage with the locality planning arrangements. I appreciate it's part of the whole community planning world, but I guess how do we make sure that we've got the best possible outcomes in terms of how we work within that kind of localities? Would be any comment on that would be appreciated. Thanks.
So, any thoughts, Fiona?
So I can start, but the team who are much closer to this, Ian's smiling, so that's good. I'll let Ian come in as well, but definitely I think there is something Richie about it, because our different localities have different needs, which always, you think in a city, you would think it'd be pretty balanced, but it's not. And I think Ian and his team are very, very good at that and absolutely working with the local community. So it's a big bit of work that Matt leads and others within Ian's team to really engage with the local communities to make sure we're meeting their needs rather than what we think. But I'm going to stop speaking and let Ian come in, who's got the details. Thanks.
Ian.
Yeah, thanks, Chair. So prior to 2020, the Health Associative Partnership actually had its own separate locality planning arrangements from Community Planning Aberdeen, and it was thought for resource purposes to prevent duplication, to share plans, share approaches, share community groups, access to community groups. So it would be best that we integrate our locality planning arrangements. So we've had our integrated locality planning team that's operated quite effectively for the last 2 years. And what that meant is that we've got 3 locality areas. So the Health Associative Partnership previously had 4. We integrate that into 3 to Mirror Community Planning Aberdeen. And what it means is that we can focus on not just the locality wide in terms of north, central and south, but we can really narrow it down and have that sort of heightened focus on our priority neighbourhoods, which are also areas which experience high levels of health inequalities as well. So for the north, you're looking at the sort of the Northfield area. For central, it's round about sort of Telly Road, Seaton, Woodside, George Street. and in south it's in Torrington and Corfe. So these are the areas that Community Planning Aberdeen had noted that needed additional focus, and we were in agreement as a partnership that these are also the areas that experience entrenched health inequalities as well. So that collaboration and partnership working between the public health team within the Health and Social Care Partnership and community learning development officers within the Council and Community Planning Aberdeen has been very, very helpful. And it means that we're adopting that sort of integrated approach. So we achieve not just the Health and Social Partnership strategic plan objectives and outcomes, but also the LOIP outcomes that are the filter through into locality plans. So it's been very, very beneficial. But what it means is that it's I have to go around and do a lot of governance sort of reporting over the next sort of few weeks. So I'll be at the Community Planning Board tomorrow, and then we'll be at full council in the next few weeks as well.
Okay. Thank you.
Great, thanks very much. I think that holistic strategic view, particularly through community planning, is so important. And I'm noting that there'll be a refresh of the locality planning activities in winter 25-26. So I mean these documents were really a great read. It's really wonderful to see the wide range of often quite diverse projects in different areas, really achieving a lot. And I think that it's particularly, as was mentioned, it's particularly important to give that focus to the SIMD 1 areas, the most deprived quintile, because it's been acknowledged that if you make a difference in those areas, then we'll be able to raise the quality of people's lives and improve other outcomes such as achievements and attainment for young people, so that they're set up better for life if we're able to address health at that granular locality level. So any emphasis on the Northfield ASG, on the St Macher ASG, the areas where we have those high areas of deprivation, I think that will be particularly helpful. There was mention in the report from volunteers. There were some challenges with finding and retaining volunteers, and I think one of the key values of locality planning is that it is all about community empowerment. It's about listening to local voices and motivating people in their communities to take part in the very many projects and activities that are in the locality plans. So we've got the Saltire Awards, which can be a good encouragement to volunteers. But is there any other way that we can really drive that volunteer initiative? Any thoughts on that, Ian?
Yeah, thanks, Chair. So we've done quite a bit of work over the last year or so. We held a dedicated event at Nescall on the 30th of January with community members to basically ask them that question. And their responses were very enlightening. So I think there's a willingness to volunteer, but I think we've got to acknowledge that the times that we're living in, the environment we're living in, often acts as real barriers to people getting involved in their neighbourhood and their community work. So, for instance, this could be the first generation of people in their sort of 50s and 60s that have got caring responsibilities, both for their children and grandchildren, but also an elderly parent. So we have seen unpaid carers numbers increase as well. Yeah. So that's obviously a form of volunteering as well. People are volunteering all over the place as well. So you think about sports clubs and dance clubs, and it's quite difficult sometimes in terms of locality planning. It's quite difficult to get people to be involved in a governance group. Sometimes people are more interested in the actual doing, where they can see it immediately. And there's just a lot of pressure on people's times and costs, and we know that people have been working maybe 2 or 3 jobs. People are going to have to retrain. This all takes people's time. So I suppose in short that there is a willingness, but we'll work with our partners in ACWO and the third sector and colleagues in ABZ Works and Community Planning to try and tease out and encourage volunteering as much as we possibly can.
Yeah, that's great. Locality planning is community-led, so getting people motivated in their local areas to become involved is crucial. But yeah, I appreciate more and more of us are stretched with time economically and so forth in these really harsh economic times. But I think that is our challenge, is wherever possible in designing the new 25-26 locality planning exercise, finding and encouraging people wherever possible will be really important. Sandy, you got your.
Yeah, I'm just going to add to Ian's. I mean, Ian's got a Grampian Aberdeen view. I go to some Grampian volunteering groups, and a couple of things they would reflect would be, you both touched on it. The economic conditions are people are having to giving up volunteer time to get jobs and get paid work. That's probably number one that people would say across Grampian. It's not an Aberdeen dynamic. Well, it is, but it's across Grampian. I think the other thing I see in Grampian volunteering group would reflect would be it's also how we treat volunteers and how much we physically say that we value them and recognise the role they're in, rather than saying volunteers can only do X and Y, but they can't do A, B, and C because A, B, and C is kind of more important or whatever. And I think there's something there about how we tell volunteers and are willing to be open. And some of those, there's some challenges there for the organisation around governance, around some of that. But I think if you think as an example, we kind of kick around a lot. There are people who would volunteer to take other people to hospital appointments in their own cars, and that's extremely difficult to try and countenance from a governance point of view. Whereas they are sitting, it's a story I used to tell years ago. I used to work and met Jehovah's Witnesses who were all willing to take people in their own cars at no cost to hospital appointments. And the answer was, well, you can't do that because governance kind of. So I think there's two main things there I would just add to Ian's work.
Yeah. Thanks very much. The volunteering resource adds so much. I mean, we're seeing through all of these reports the reliance on the goodwill and the value that individuals add. It just goes beyond measure, and yeah, that's our challenge, I suppose. Ian.
Yeah, thanks, Chair. I should also mention that a really effective way we found of getting more volunteers involved is through the external funding streams that we have. So thinking about the UDecide participatory budgeting, 20,000 for each locality, that encourages community-led projects, community bids, community members get involved in the voting, and we've got the Health Improvement Fund annual reports. I'm sure Chris will go into a wee bit of detail later on, so don't want to step on his content a bit too much. But in 2023-24, the Health Improvement Fund led to nearly 9,000 volunteers getting involved in across the city. So I think that's, Chris will correct me if I'm wrong, I think that had a value of about £147,000 in terms of dedication to the city in terms of the health and social care economy. So volunteers are incredibly valuable, and we can't run an effective locality planning system or deliver our community empowerment strategy without them.
Yeah, absolutely. I mean, I think it's wherever possible, it's worth factoring in that kind of information for future planning. In fact, we've got a comment there in the chat.
Sorry, Chair, that was me. There was just 9,000 volunteer hours, over 400 volunteers.
Okay, yeah. I mean, that's amazing. And it does demonstrate that there's an enormous desire to offer care to other people in the community. So very positive. John.
Yeah, just a couple of brief comments, really. One, in terms of volunteers, I think we do talk about them as a resource, but actually volunteering in itself can be very good for mental health, well-being. I mean, I talked to the volunteers at the Gordon Highlanders Museum, without whom the museum couldn't function. And for the volunteers, most of whom are retired, it gives them a bit of structure to their day. It's part of their social life, and it's really good for them as well as being good for the museum. And I'm not sure I should say this, but in terms of Sandy's point on governance around people giving lifts, I was once told at my church, the rector can't say, "Can you give Billy a lift to the hospital?" That's breaking the law. But if the rector says, "Do you know what? I reckon Billy could do with a lift to the hospital," but let's talk about football now. Yeah, I probably shouldn't have said that, but I've said it anyway.
Nope. It's all about relationships, and locality planning is about building and finding ways of creating and nurturing that interconnectedness without which we couldn't function. So that's all been really, really positive. Yeah, an enormous amount of detail, great projects in here in all parts of the city. So thanks for this really welcome, excellent report. I'm happy to agree the recommendations for 6.1. Yes, that's all agreed. Thank you very much. On to the PSIP at item 6.2. Do we have questions on 6.2? 6.2. Yes, we've got Hussein first.
Thank you very much, Chair, and thank you for the report. So I'm trying to make sense of my own comments here. 4.4.3, there's a review report mentioned. I'm just wondering if we had a timescale for that.
4.4.3, yeah.
4.4.3. So that's our PSIP review, I think, Hussein, that you're referring to?
Yes, please.
Okay, so the PSIP review, we will have a report around that. What we're aiming for is an individual report for each of the work streams, and this will incorporate the 3 partnerships. So we're a pan-Grampian, and then ultimately, on top of that, we would have an overarching report for the whole review, which we will be presenting to the GP Visioning Board at the point of when that's ready.
Okay. Is there a route for anyone who's kind of interested in some of the detail of that to be able to see that? I mean, appreciate the kind of operational and in many ways the strategic plan for that sits with the board, and quite rightly so. I'm just wondering if anyone did want to read that. Is that something that's possible? Does that sit anywhere?
I'd need to refer to the visioning group around that, Hussein, but I wouldn't think there should be an issue around that report, but I will be taking updates to the IGB as well, so I think that's possibly the route that we might go, but I can keep you informed around that.
Yeah, I've always been very interested in this project,
Yes.
obviously personal interest, but also because it's such a fundamental aspect for the very foundations of healthcare going forward. So it is a bit of a geeky interest of mine, but I appreciate that when it comes through. And if you're able to, I don't know if there's a link or something that I will go somewhere for people to access if it doesn't have a formal route, or if that can be shared confidentially. But I'll leave that with yourself for now. But no, thanks very much for that.
No, thank you very much, and thank you for your interest. It's been quite a challenging project, or a very challenging project, just because of the scope of it, and we were just stepping into the unknown, so it's been quite hard to, it's a bit like herding cats, to be honest with you, so it's been quite difficult, but
Well,
thank you.
No, thanks to you and the team for the work that you've done. It's really appreciated.
Thank you.
Grand. Richie.
Yes, thanks. It's similar to Hussein, actually, that if there's someone who just, I guess, read this in a bit more depth, would be really good. It's so wide-ranging, as you say, Alison, just in terms of the reach it's got and the different stakeholders, whether it's patients, GPs, commissioners or whoever it might be. There's lots of different angles, so it'd be good to get, this maybe is not the place or the time to get too much into that, but we'd be dead interested in how that looks. My question was around the funding, and I know the kind of steer is to plan as if funding continues in terms of the different projects and activities. And so I guess it's just a question: is there any more update in terms of what that means? Is it flat cash? Is it still non-recurring in that sense? But yeah, just any update on the funding position would be helpful if you have it.
Yeah, so we're still waiting for a confirmation of our allocation for this financial year. We complete a tracker and send that back to Scottish Government. So that's really around our operational performance. So it's around about workforce, what we've spent our money on basically, workforce, and there's a funding financial section as well. With the papers, when the papers come out for the completion of that tracker, they did intimate that they would confirm our funding allocation in the first quarter. So that would be the 30th up until the 30th of June. So we're expecting something this month. However, it has been later than that in months gone by. But they've had a lot of feedback from various boards saying, we really need to know sooner, because we're planning on the basis that our budget, our allocation will be the same, which it has been for the past 2 years. However, it's difficult for us because, the pressures around that budget and the spend are increasing. So we need to bear that in mind, take cognizance of that when we're planning. We come in slightly under budget this financial year past, which has been a challenge because most of our money is spent around workforce. So you just don't know how that's going to go. You could have people who resign 2 months before the year end. So it's hard not to come in an underspend, a high underspend. So it fluctuates quite a lot in terms of what we're spending our money on. We're not expecting an uplift in the funding is the message that's coming across. So we're expecting it to be a flat line. They are talking about baselining. They've started baselining some of the budgets already. So they do mention it year on year that they'll baseline the PSIP. But at the moment, as far as we're aware, it is a sort of non-recurring budget that we're working from. So it's recurring, but in a non-recurring, it's difficult to we don't know if they're going to say they're going to change it, how it's going to come to us. So at the moment, we're just waiting for our allocation, and hopefully, if they do baseline, it will be in a better place. But we have planned for baselining. We've allocated budgets for each of our work streams, so we're working from that now.
Okay, thanks, Alison. Thank you.
Thank you.
Thanks. So could I just ask about the C-tax, so the clinics there? There's some really positive information there. I'm just wondering if is there an aspiration, maybe, and is it realistic to see the hubs expand and increase? I mean, looks like there's increasing amounts of contacts there, so that's helping to take the pressure off of GP surgeries and elsewhere. It's helping people to understand that health delivery is diversifying, helping people's expectations of, if you've got a problem, you don't just go to your GP. There are other alternatives. So is that an area where we might see more activity, more hubs and so forth?
So at the moment, we've spent, we're spending up to the maximum in our financial envelope. The split in our budget in terms of across the work streams, CTAC get the highest proportion, just how it's worked out. We would like to probably extend, but we'll see what comes out of the PSIP review. So we've got 8 hubs across the city. We have shifted these around. We've constantly monitored the activity, the demand across each of the hubs. So we do shift, and we shift our nursing level of nursing across here in terms of, are they trained nurses? Is it more band 3 healthcare support workers we need? So we're constantly working within the budget that we've got at the moment. But any plans in the future, would be an outcome from the PSIP review going forward.
Okay, which is underway, or
it's
about to
underway.
restart?
It's well underway. No. it's well underway. We're working on a Gantt chart at the moment to see if we can pull this in by the end of this year, but that's just an aspiration at the moment. We don't want to set something that's unrealistic, a tokenistic timeline against it, because it has been a lot of work.
Yeah, it's great. Okay. Any other questions on this report? I think we all welcome it as a really positive additional support that's making a difference. So are we happy to agree the recommendations for 6.2? Yeah. Okay, 6.2 is agreed.
Thank you.
Thank you very much indeed. Which takes us on to justice, social work and 6.3. I see Val is here. Any introductory comments?
Thank you, Councillor Gregg. Just a short introduction, just to say that the report's provided to the Committee for Assurance purposes, and it presents our Justice Social Work Service delivery plan for 2025 to 2029, which now aligns with the Health and Social Care Partnership Strategic Plan timescales. The delivery plan sets out our key outcomes and objectives, as you'll see, and how we aim to achieve these to improve outcomes for those who use the service. And as well as our local objectives, we align with the national outcomes and standards for justice social work and the care inspectorate quality indicators, and also, of course, the local outcome improvement plan previously mentioned. That's all I was going to say about it, really. I'm happy to take any questions.
Okay, thank you very much. I wanted to ask about there's mention of training resource, particularly I think, and there's also mention of delivery of the Caledonian system and the MF2C service. So is there that additional activity in training and providing the assessment tools that the practitioners need in order to move forward with these actions?
Apologies. The training tools, whereabouts?
So page 242, there's mention of training and staff development and so forth.
I can come in. So the training for the Caledonian and moving forward, making changes, the sex offenders programme is national training, Chair. So one of the things we've got to do is they have a certain amount of places per year right across Scotland, and obviously we have to apply for slots for that training. So trying to get as much people trained right across the service as we can. Sometimes we're only given a few places per session per year. And of course we have done a huge piece of work on the back of the national training, also about what is our local training in amongst that. So we've got a training needs analysis that we undertook. So we're going to be having a more focused view and, I suppose, collaboration with other areas in terms of what is our training that we can do locally, and actually how do we secure more places nationally, just to make sure that we've got as much people trained as we can in the national tools.
Yeah, thanks for that. Professional development will be crucial for building up specialised knowledge and responses. So
absolutely.
So that's good to hear. And there's mention there of a staff survey. So presumably there will be feedback on educational and training needs from staff.
Yeah. Yeah, that was part of the training needs analysis we did. So we did the staff survey
Mhm.
to look at particular obviously to hear the voices of frontline staff and workers in terms of the training that they get already, what they actually would like training on,
Mhm.
just to kind of build up that not the performance framework, the training framework that we're putting in place. So just so staff can be part of that to create that
Yeah.
catalogue.
Yeah, that's great, because all of that learning will be vital for the 25-29 delivery plan. So great, thank you very much. Richie.
Yeah, thanks again, and thanks again for another good report and update. Been a few of these on the agenda today. Just a kind of question on monitoring and reporting, just to remind me just how that's done, how the action plan is monitored, and where that next gets reported to. Just more for nosiness than anything else, to be honest.
I can. Oh, do you want to
when you
speak
come,
first?
no, when you come, Val. Sorry, I'm taking over.
No, it's okay. I was going to say that we have within Justice a performance management board which meets quarterly, which is chaired by Chair or even chaired by Claire. And that's our kind of formal oversight board within the service, on which we report on a regular basis on the plan and wider issues as well. And I'm also scheduled to come back to the November meeting of this committee with our 2024-25 annual performance report against the last kind of full financial year. So that's an annual report to this committee in terms of performance.
And just adding to that, you've got the LOIP stretch outcome, and so they'll be reporting to, I don't know, community planning board or the management group there as well.
Yeah, so I chair the Community Justice Partnership for Aberdeen. So yes, I report to the Community Planning Board with the LOIP, because as Val says in the paper, we've got a duty to create a community justice improvement plan, but in Aberdeen we incorporated that within the LOIP. So but yeah, we go to the Community Planning Board as well.
Right, okay. If there's no more questions, can we agree the report, the recommendations in the report? Yeah, many thanks for the report, for all the detail there, much appreciated. Thank you. 6.4 is the Health Improvement Fund annual report. Is that one? Anybody got any questions on the Health Improvement Fund annual report? Hussein will kick us off.
Thank you very much, Chair. Another excellent report, and it's really good to see how this funding is going into community projects and a number of projects that are there. I think, if memory serves, there were 75 projects that were allocated funding. I suppose that then begs the question, I'm guessing there is a selection process behind bids that are received. There's some sort of competitive bidding process that goes on. And it then begs the question, for those projects that are unsuccessful in receiving funding, is there then, forgive me, Chair, I forget what the team's called in the council. I know the council have a team for looking at external funding sources for organisations that are unsuccessful in bidding for other streams, and they will work with these unsuccessful applicants to try and seek funding from other places to make sure that their projects have some opportunity to get off the ground somewhere. So I guess I just wanted some narrative as to, does that also happen here with this improvement fund? And
yeah,
what number of projects are still being funded somehow through some source, even if the funds that we have here are not able to meet their needs? Because I'm sure that there are just as many projects that have just as many great outcomes, but we don't have the resources to meet that. So it's just really, what happens? What's the route? How is there a number as to how many succeed elsewhere? And obviously, sadly, there will be some that we just can't support and are not able to attract funding elsewhere. Do we have any quantification of that? Sorry, that's not a very well put question, but
Chris is going to help with that question.
Yeah, thanks, Chair. Yes, we certainly have a selection process that goes through that involves both the community, third sector, and the health and social partnership staff that kind of are involved in deciding how that money is allocated in the funding based on those needs. I think over the last kind of 3 years, we've had a number of examples of projects who haven't been funded, but we have worked with our other partners locally to support them to access funding, be it through the Community's Mental Health and Wellbeing Fund, the Fairer Aberdeen Fund, the COVID Recovery Fund. So different funding streams, and again that's flexible depending on what fund's available at the time of application. So again, we're tying in with the kind of key partners around about that, so we don't leave anybody kind of high and dry. Although there's I think in years 22, 23, the figures were like we managed to fund 72% of all applications of all projects coming through the period from multiple different sources around about that. I don't have the most up-to-date figures for that, but that's certainly the ones that were there. And again, but there's been discussions lately, and we've got a light project looking at how we could coordinate funding across the city and how we encourage different ways of being able to fund community projects. So we've got all the local funders together, so that's going to help support that process as well. I think an additionality, there's also we fund a project, and I think Hussein, you kind of highlighted this at the IGP Insight Day, that there are some projects that we potentially benefit from multi-year funding in that example. So we've got projects that, and you can see from the report that 63%, 64% are continuing beyond that period of time. But let's see what the other projects need for continuing that support and also for scaling up. So I had a conversation with one of the projects we funded last year on Monday, and they were looking at about applying again for funding, but we actually kind of talked it through and actually thought that the next step would be actually to look at a kind of national lottery award. So looking at building that kind of funding stream, that longevity in there. So again, it's just about making sure that we're having that conversation. We're working across our partners, but I think over the last 3 years we've developed that relationship. So the people receiving the funding and also applying for funding, we're trying to get that kind of good relationship so we can keep that continuing discussion going on, so we can respond as to needs as and when they arise as well.
Thanks very much, and you've answered my kind of follow-on question, which was, if projects are continuing, where are they continuing from? And that will obviously be other places. So it's really good to hear that there is that kind of handover. The tap just doesn't turn off and then off you go and do things yourselves. And I think it's really welcome that you're doing that project to try and, if not amalgamate, then try and streamline this whole where do I go for funding, given there are so many different streams. And having been in the position of trying to navigate that landscape, albeit quite a few years ago now, from the perspective of particularly very, very small micro organizations, or even just very small community groups that are not established per se in the full sense of that word, it is extremely difficult to know where to turn. You have that brand recognition for things like the National Lottery. You might think, I'll go to the council for funding, but where do I go to the council for funding? How do I know what's available if I don't know what they're called, or if I don't know what their different criteria is? So that's really welcome, and be very interested to see the output of that project, and hopefully more projects are able to get either the seed funding that they need to get started, or to establish themselves once they've gotten themselves off the ground. So thank you for that.
Yeah. Lovely. Richie.
I wasn't going to comment on this paper, but I'm going to blame Hussein for putting the thought in my head. And that last conversation was really good. It's kind of connected to that last conversation about that coordination, as Chris, you put it, around what the opportunities might be. So that's really good. And this is more of a comment than a question, in fairness, but it is. And having been, I guess, in that world myself in the not too distant past, and looked at today's agenda in terms of different types of reports about health improvement fund, locality planning, primary care improvement plan, justice social work, and our own delivery plan. There's so many different plans and funding sources. I guess how you make sense of all that in some kind of coordinated, integrated fashion, and it's incredibly difficult. I'm not sure if there is an easy answer, to be honest, and not just at that kind of local project level, but right up through to get a strategic level funding. So I guess it's more just a comment that I think today's agenda has just reinforced to me that it's just bringing that together in the most cohesive way possible is of course a good thing. So it's more of a comment about recognising the challenges around that. So rather than, I wouldn't frame it as a question, I don't think today, it's just to acknowledge that.
Grant. Thanks for that. Chris, do you want to just chip in, please? Thanks.
No, just to kind of response, I think through the kind of development of the locality plans and the LOIP reports and things like that, we've certainly come across that, and there's been discussions going on about how we can align our funding streams to more the annual reporting, so people can report once potentially, and we can feed them into the different reporting streams. So I think that's work in progress, and we've certainly, from a health improvement point of view, we've definitely kind of integrated that into the locality plans, as you'll have seen in terms of the health improvement projects being reported back, and through the LOIP annual report as well. So it's work in progress, but I think certainly from our perspective, that's kind of working.
And Ian.
Yeah, thanks, Chair. Just to follow on from Chris's point there. So Chris is a member along with myself on the integrated locality planning team. So just by virtue of him being on the team, you can make these connections. And community planning have went through a wee bit of a sort of restructure in terms of their staffing, and that's brought managers who are responsible for Fair Aberdeen under the sort of locality planning banner as well. We've got very good relationships with ACVO, who administer the Community Mental Health and Wellbeing Fund as well, and very conscious of, if you think back to the Christie report from 2011, they talked about the cluttered landscape. And it's basically our job in locality plan to try declutter as much as we possibly can, try and bring under an umbrella, try collaborate and integrate and make sense, because we do have limited resource and we've got to maximise what we have.
Yeah, thanks for that. I think that the decluttering responsibility will continue, and indeed is likely to become even more complex. I think the Health Improvement Fund has done an enormous amount of added value, goodness to the various groups and individuals who've been involved. It's just splendid to hear about the variety of activities. Very conscious that it's a very finite fund, but those who apply, they add so much extra, so that when and it's actually useful to have the graphic which shows you that bigger economic equation of what they're effectively volunteers, what the resource, what the additional resource contributes towards achieving health benefits, and I think it's useful that we are interpreting defining health in a very broad way, and indeed we're looking at health. The council, for example, is looking at health inequalities at the core of all of its decision making. All of our evidence will be all of our decision making and evidence base will be around the health determinants research. But I mean, mindful that it's a very limited pot of funding available, and I'm just wondering, it must be difficult to make some of those funding decisions, because there will be, I mean, we've got the different categories of eligibility, and some might argue that some of the categories are more important than others. So, for example, there's the physical activity group. I think that if there was any proposal to give a special focus on that, I think that would be helpful, because of the very clear primary care benefits that come from that for all ages. And yeah, and also as we prepare for 25 to 26 and the new strategic plan, I think it'll be useful if we're able to factor in some of this information about the extra that we get from these funds, and from the willingness to contribute from from so many groups, communities, and individuals. I think it's a much more complex and maybe cluttered equation than we're used to, but that's good. If we're done with questions on 6.4, can we agree the recommendations? We agreed on the recommendations for 6.4. Grand. Okay, that's approved. We can go on to 6.5, the delivery plan update. Any questions on the delivery plan? Or are we content with the delivery plan? It does provide us with a very useful overview of everything, and I think that the dashboard is able to help organize our thinking across all of the delivery plan universe. So, are we content with the recommendations on the delivery plan? John?
Yeah, sorry, it's just a thought in terms of the number of projects that we've got listed. Given that some of them are closed or complete, would it be sensible for future reference to kind of stick the closed and complete ones in some sort of appendix to say this is what we've done in the past? Just so we can maybe, if we do need to, maybe focus more on the ongoing ones. Just a thought.
Yeah, Alison.
Thanks, Martin. Thanks, John. Yeah, absolutely. This is your State of the Nation end of year 3 delivery plan report. It will be kept for posterity. So that is the that is the final one for the existing strategic plan. When we move forward into the new strategic plan, we'll have new delivery plans that deliver against that, and the ongoing projects will be captured in that. But absolutely, these closed and completed and other ones that have been transferred into business as usual. That's a record of what we've done with that. Or with those. So if anybody comes back looking for an audit trail in future, I'm looking at Jamie there. I'm quite sure at some point they'll be coming to check on what we have and haven't done. So absolutely, it's there, it's captured. We can track through what we've done.
Okay, thank you very much. Hussein.
You can blame John for this because he's now got me thinking. Just in terms of readability, would it be possible for the future reports to group these by not RAG status, but to group these by completion status? It just makes it easier to zoom in on particular projects of current relevance or query.
Yep, absolutely, Hussein. That's the intention of the revised reporting that you see, that mock-up of the dashboard. That will give you an easy landing page in terms of the projects by RAG status, and then you can delve down into greater detail only on those that you want to see. So if it's just the red and ambers that you want to have a look at, you can filter that. The plan is to use Power BI, which is a very powerful tool in terms of being able to drill down, display the information in a way that makes it easier for people to navigate through to the bits that they really need to see, and not necessarily even look at the ones. So what we're going to suggest is, if everything's green and on track, etc., these are ones probably you don't need to worry about, but you need to focus on the ones where we're raising concerns, either in terms of timescale or funding or workforce or whatever could be the barrier to delivery. So that's the plan for going forward when we're into the new delivery plan reporting.
Got you. Thank you.
Okay, so can we agree the recommendations on pages 283 and 4 for the report on the delivery plan? Okay, grand, that's approved. Our last item, which I don't think we need to agree, is the date of the next meeting. 27th of August 2025. Thank you everyone for being here, and a special, I think this is your last meeting, Amy, of the committee, so special thanks to you. Huge expression of appreciation for all that you've done for us, and we all wish you all the best. So thank you very much, Amy. And so that's it. The meeting is over. Thank you, everyone. All the best. See you.
Thank you. Bye.
Thank you.
Thank you.
Thanks, everyone.
Bye. Bye.